Welcome everyone to the session where today's topic is NCLEX Next Generation 2023, the changes that are going to happen soon in the NCLEX examination. For those who, this is our first meeting, I'm Jason, and I basically work in Edilogics, helping overseas registered nurses who want to get their nursing registration, nursing license in Australia via the OBA pathway. So I also help nurses who do not want to take the OBA pathway, but prefer to doing other programs like bachelor's and master's of nursing, leading to registration. And we also assist on those pathways as well. So if you haven't come across our YouTube channel, which is a very popular YouTube channel amongst overseas registered nurses, we have more than, I think, 3,500 subscribers on YouTube. Plus on Facebook as well, we have a very strong community of more than 3,000 nurses. And we try to put a lot of informative videos for overseas registered nurses about OBA, NCLEX, and OSCE, and also about other courses and other pathways to get your nursing license in Australia. Little bit about Australian nursing registration. I know that a couple of you are joining from Middle East, so I'm not sure whether you're aware. So in Australia, basically there are two organizations that control the nursing registration procedure as well as nursing standards or for registered nurses and enrolled nurses. They're called Nursing and Midwifery Board of Australia and APRA. And APRA has been consistently doing a lot of changes in the nursing registration system. And I'm not sure whether some of you must be aware about the previous registration system where, there were courses that overseas registered nurses could do, which were called bridging program. And these were 3-month short courses. You could do it and then get your nursing license. There's no bridging program available anymore. And this was stopped in 2020, March. The last batch, I think, that came in Australia for the bridging program was February 2020. Okay. So if you want more information about other courses that lead to registration, you can give me a separate call and I can explain you about the eligibility, etc. on those things as well. Okay, so those of you who are not aware about the current OBA procedure, it's called outcomes-based assessment. And it's basically you have to apply in the APRA portal via self-check system. You need to submit all your educational qualification documents and everything. And as per the standards that has been published by APRA, and you do an initial payment of $640 and complete your documentation and everything. And then APRA assigns you a case officer. And that case officer basically goes through all your documents and then allows you to write the NCLEX examination. Okay. Now, every time you write the NCLEX exam, that costs you to $350 USD. And the OSCE examination, the practical examination after your NCLEX examination, is a 1-day practical examination which is conducted in Adelaide. And the fees for that is $4,000. Okay. So you essentially need to pass these two exams to get your nursing license in Australia. Okay. And after you write and pass these two exams, you've reached the final stage, which is called registration, wherein you are, now basically completing your registration process, getting your criminal history check done, submitting your IELTS, PT, etc., and paying a 475 Australian dollars to get your nursing license. Okay. And the last stage that APRA says is basically orientation 2, wherein you are required to do a training program, online training program, within the first year of your registration. So you can do it from anywhere. You don't have to go anywhere. You can do it from your home, and it's a short program that you can do and complete your procedure. Okay. So I'm not, as I said, many of you must be aware of this procedure. For those who do not know this is kind of the gist involved in the Australian nursing registration system. And if you need any help, who have limited knowledge about NCLEX, so NCLEX is regulated by NCSBN and it's conducted by Pearson VUE in more than 200 countries. So it's very likely that where you're living, there will be an NCLEX examination center, but some of the countries do not have the NCLEX examination center as well. Like Nepal doesn't have. Those who are in Middle East also struggle to find an NCLEX examination center in their country. Okay. Now, NCLEX is set at entry level, which means that how NCSB defines it is that it is for a nurse who does not have more than 12 months of experience. Okay. So how they basically create the questions is they do something called a practice analysis, and they talk to thousands of nurses. They conduct a lot of researches and try to understand what a nurse who's in the first year of their nursing practice, what are the common scenarios, patients, concepts that they come across, and based upon that information they create the items or questions for this exam. Okay. Now, NCLEX, although new to Australia, it's not new in the world. The US and Canada have been using NCLEX from a very long time. And those who do their graduation in US and Canada, who do their bachelor's program in US and Canada, also need to undergo their NCLEX exam before they get their nursing license. Okay. And this is not implemented in Australia yet, but I won't be surprised that in the next couple of years, Australia also adapts to that system of registration. Okay. Now, if you pass NCLEX, your validity will be 10 years and you can score transfer between other countries, which means that if you haven't got your Australian license, if you wish to practice in Canada or US, you can transfer your scores from APRA to those state boards of nursing in US or Canada. Okay. Now, this is basically a slide to tell you about the latest results statistics of NCLEX examination. It's a very common question that everybody asks, what is the pass percentage of NCLEX? So generally the pass percentage is that if you look at the internationally qualified nurses, and this data includes Australia. Okay, so if you look at the internationally qualified nurses, the 100 people writing the exam, 44 to 46 nurses pass the exam. So it's less than 50%. But if you compare that with, let's say the bachelor's degree nurses who have studied their nursing in US, 84% of them pass the exam. So which increasingly, tells us clearly that there is a major problem in how, internationally qualified nurses are being taught. And there is very little focus on critical thinking, clinical decision making, more subjective questions, and ratification, or what we say mugging up of answers is there. Whereas those who do their qualifications in these countries like US, Canada, and Australia, they kind of focus a lot on critical thinking, objective questions, and they really see whether you can make a sound decision based upon the data that has been presented to you. Okay, so if that's what basically I would like to say, that there is definitely a big gap between those who write the exam from other countries and those who study there and then write the exam. Important things about the NCLEX exam, which is the current format. Okay, so there are 75 to 145 questions currently, and the maximum time is 5 hours. And the NCLEX uses something called CAT, Computer Adaptive Testing, which means basically each person's exam is very individualized or unique. And, every person gets a different experience of the examination. So, it may happen that, 2 people go together and they have the same examination time, date, hall, but it may happen that the first person gets 75 questions, the other person sits for the whole 145 questions. When you discuss with them, both of them may have got completely different concepts to be evaluated. And, the number of questions may vary. So it basically modifies based upon the person's unique character, unique way of answering questions. Okay. As I said, that the core concept, or, the core of NCLEX is basically to assess whether you are a safe nurse. Will you be able to deliver safe nursing care? And will you be able to critically think in situations, and or are you one of the person who's just waiting for the doctor's orders, and you can't evaluate situation and you can't take independent decisions based upon your scope of practice, not outside your scope of practice, but within your scope of practice, whether can you critically think and see what can be done best. Okay. Now, in the current format of questions, there are different types of questions. You will see there is single answer, which means, there will be one question, let's say 4 options. One may be correct and you have to select that particular option. Then there is SATA, select all that apply, which is basically one question, let's say 6 options, 4 options are correct. You have to select all 4 to get your answer correct. Even if you select, let's say you select 3 options which are correct, but you selected one which was incorrect, so you get a 0 score for that particular question. Okay. Then you have fill in the blanks, very straightforward. You have exhibit questions or basically diagram questions that may ask you to label things. Then drag and drop or something like a match the following are the different type of questions that you may see in the NCLEX exam. Okay. So this is basically a bit about, what is the current structure. Till now, what I have explained is the current structure, and many of this current structure is going to continue, and many of it is going to change as well. Okay. Now let's talk about the NCLEX Next Generation, which is basically the new format of examination. This exam is going to launch on April 1st, 2023, which means that until March, you can write the examination in the old format. But from April 1st, 2023, the new format is being implemented. Okay. Now, as I said, if you recall, I had told you about the practice analysis research that they conduct. And they increasingly found in the practice analysis research is that the scope of practice or the scope of things that are very rapidly evolving for nurses, and more complex situations were coming in front of nurses when they were delivering their patient care. Okay, so what they have tried is that they have tried to incorporate these specific situations and make questions more detailed in the new examination format, and I'll explain you how they have done that. And based upon these observations, the new examination is will be conducted. Also with that, if you're aware that NCLEX, NCSBN publishes a test plan, which basically is a syllabus for your examination. Now that with the new examination or Next Generation, which is coming on April 1st, the syllabus or the test plan will also have variations. So NCSBN will publish the new test plan. I'm hopeful that within this year or early next year in January probably, so that students have an idea of what variations are going to come. Okay. Now coming to what exactly is changing. Okay, so the biggest change that I can explain you is that first is the type of questions. So case study questions are going to be involved, which means that you will see 3 different cases in your examination, and the case study will be very elongated, very elaborate, telling you about the patient, medical and physical history, vital signs, medications, previous medications, what is their current status, what were the presenting symptoms, etc., etc. And based upon this detailed case study, you will be provided 6 questions in each case study, which means that you will have total 18 case study questions to answer. Okay. Now, nevertheless, I would say that it does sound a little more complex and complicated than what is currently, because current format is, stem of the question, some basic information, and then options to choose. Whereas case study questions requires you to, go through the information in detail, carefully, critically analyze the information, and then answer those 6 questions. Okay. So number one, this is the biggest change that is going to happen. 3 case studies to be included, 6 questions in each case study. Altogether, you will be able to get 18 questions for your case study questions. Okay. Then they're also introducing some new item types in the examination. And I'll show you a video about this new item types in my next slide. And also, there's going to also be a new scoring method, which is a little different from what is being currently done. Definitely, the format is a bit different to what is there currently. Okay. Whether it will be more difficult or less difficult, we can't very much judge that. That can only happen once the students write the examination and let us know their experiences. But what it looks like is that it's going to be a little more complex and more focused on critical thinking than what is currently there. Okay. Now I'll just stop for 1 second for any questions till now. I think I saw Nina ask some questions. Nina, did you raise your hands? Any questions for me?
No, all good, ma'am.
Okay. Anyone else? Any question till now?
Ma'am, how can we prepare for the next generation questions?
Okay, sure. I will definitely help you answer that question in the further slides. Definitely, it's about a lot of practice going through all the resources, and we'll have more information about the examination and if any recommended resources that NCSBN shares. Probably, I think in the first half of, in the first month of the next year, and let's see how it goes. But anyway, I have few tips for you to crack that as well. Okay, now let's talk about the scoring. So as I said, the current, there is also going to be a scoring change in the examination. So current format of scoring is very simple. You answer one question correctly, you get the score, which is all correct. Okay, or you answer incorrectly, you get a 0. Okay, so as I gave you an example for the select all that apply, if there are 4 options which are correct, you have to select all 4 to get your correct, your one score. Even if you have selected one which is wrong, you essentially get a 0 in that current format. Okay, and I can tell you that SATA or select all that apply questions are a big pain point for students, and they really feel that those are challenging questions, and most of them are able to get a couple of them correct, but it may happen that they're selecting one incorrect, and because of that one incorrect answer, they lose the mark. Okay, so the changes, or what I would say the new scoring method is, one is that few questions will remain as it is right now. For example, multiple choice item, single stem, 4 options or 4 or 5 options, and you have to select one which is correct, and you get the standard score, which is 0 or 1, the same format as current. Okay, the second is basically it's called plus minus scoring, which means that for the SATA questions or extended SATA questions, that earlier if you had selected even one wrong, your whole question is considered to be 0. But in the new scoring, plus minus scoring, let's say there are 3 options which are correct, you have selected all the 3, but one which you have selected is wrong, you will get 3 points for the correct answer, and your score will be deducted by 1 to reflect your correct score, which is 2 points. So if you see this example, 3 answers were correct. The person also selected one which was incorrect. So 3 points for the correct response and 1 point for the wrong response. So they have deducted the basic maths. 3 minus 1 is equal to 2. So earlier the person used to get just a 0 for this question. Now the person has got points of 2 for this particular question, which is I think is quite positive in this new examination format. And it's basically something is better than having nothing. Okay, now there are some questions which are going to introduce, like basically cause and effect questions, which is there are 2 different things and they both are interrelated. For example, if you see this question, it's a drop down question. So the client is at higher risk of developing dash as dash evidence by dash. Okay, so both of them are interrelated to each other. Now in such type of questions, you need to select both the options because they are interrelated. Okay, they're not independent, they're interrelated, and hence if you select both of them, then only you get a full credit point or 1 score for this. If let's say even one of them you have selected wrong, then you get a 0 point because both of them are independent, like dependent on each other. Okay, so for example, rational, when you see a rational, this happens because of this. So even you need to have both the concepts clear, and if you select even one wrong, which basically indicates to NCSBN that there is some issue in your clarity or there's some issue in your understanding of that particular concept. Okay, now this is called rational scoring. Okay, so these are the new scoring methods which is basically implemented in this examination. So just summarizing the major changes: number one biggest change, case study questions, 3 case studies, 6 questions each, altogether 18 case study questions, elongated format. Okay, the type of questions are changing. You will see extended, select all that apply, drop down, close questions, and other different formats of new types of questions. And the last one is the scoring mechanism is going to vary a bit. Okay, now in terms of how we can help you, I can definitely tell you that I'm not sure whether that I mentioned that this examination change was supposed to happen in 2022, but this was postponed to 2023 because of COVID, and hence because we were not aware that this exam change is going to happen, we already started preparing for the new exam change with using whatever resources were available on the internet and NCSBN website, etc. And our trainers, some of our trainers have been in very active parts of various NCSBN conferences that they have been doing, both online and face to face, wherein they've tried to teach people how to teach NCLEX in the new examination format. Okay, and although there are changes that is happening now, but you all have to remember one thing, that fundamentally nursing is not going to change. The concepts of nursing is not going to change. Maybe just the methodology of the examination may vary a bit, but it doesn't take away from the fact that you're still being tested on your nursing content knowledge, which means that you still have to go through all the different types of different content area, which is management of care, safety, infection control, basic care and comfort, your medical and surgical, your health promotion, maintenance, psychosocial integrity. All those things remains the same. There's no change in your nursing content knowledge. Okay, so you need to have that thing in your mind. Don't think this is going to be end of the world. Change is inevitable. We all need to adapt to the change. Okay, now we can help you in terms of your preparation via the NCLEX program, and as I said, we have already started doing those changes in our preparation as well. And most of our students are those who are currently targeting to write the examination in March, but hopefully by next year we'll also have massive number of students who will be writing the new examination from April 2023. And hence, if you are someone who's planning to write the new examination, we can definitely help you. And also, if you're someone who's going to write in the old exam format, as I said, the nursing fundamental knowledge does not change. It remains the same. Okay. Now, we offer a 10 weeks NCLEX program with Thursday and Friday classes. And between Monday to Wednesday, every week, you get what is required from you for that particular week. And you have to go to our LMS, you see, and you find out, okay, what's going to happen on Thursday and Friday. Let's say you're doing management of care, so you have to sit and watch the pre-recorded lectures for management of care. You can do it on your own time based upon your schedule, and complete those video lectures, go through the book and go through all the material that we have provided you, and then do the practice questions before you come for your Thursday and Friday class. The Thursday and Friday classes are basically strategy classes. Those classes are there for your revision of that particular concept, in this case, management of care. So revision of major concepts, strategy, and lots of practice of NCLEX questions is what you're going to do in the 2 days. Okay. We try to make it as flexible, as we're aware that, increasingly the students are also very, very busy. And hence it is something that suits a busy person. You can do majority of the things on your own. And Thursday, Friday classes help you to clarify any questions that you have, or you have, noted down during your other days of your preparation. Okay. Now we provide you all the question banks, mock examinations. We provide you 4 different mock exams. After every mock exam, you get a personal feedback. You sit with the trainer tells you, okay, this is what is happening in each of your content area. What can we do better so that when you do your second mock exam, let's say after 2 to 3 weeks, what is going to happen? What do you have to do to achieve your goal? Okay. And I think I'm very proud of it that, we are the only provider in Australia who provide individual feedback to the students. And otherwise, most of the other providers have like a common feedback session that I feel that, really help the students to get that, personal time with the trainers. Okay. And as I said, the access is for 1 year. You get full 1 year to prepare for your NCLEX. And I can tell you, I always tell everybody that if you think that you have done enough of your preparation and you have, let's say, have been unsuccessful in your NCLEX attempts, and you think I have spent my whole 1 year my best way possible, this is what I can do maximum. I know my book by tip. I have gone through all the important resources, done mock exams, and there's nothing else that I can do to write NCLEX. Then in that case, NCLEX is not for you. Okay. And it's very normal as well. Many people, I have seen students who have failed 3 attempts as well. Okay, 3 or 4 attempts as well. So in that case, if you think that I've done every single thing under, every single thing, put a lot of effort, time, energy, everything, and then if you can't crack it, don't stress, find another alternate pathway. But if you think that, this is not my best effort, I still need to, there was a lot of things that I could improve, then you go ahead and prepare yourself. And hence this program is very suitable for those who are first time NCLEX takers as well as repeat exam takers. Okay. The fees is very, very nominal. It's just $900, and you get the whole support and every resource access, question banks, online books, mock exam for a period of 1 year. Okay. Now, if you have already passed NCLEX, which is unlikely because you're in this webinar, but just to let you know, we also provide OSCE with our training partners in Sydney, Melbourne, Brisbane, and Adelaide. It's a 3 weeks program, 2 weeks online, 1 week on campus, and it's unlimited, which means that you can do online your OSCE preparation as well as your face-to-face OSCE preparation as many times as you want. Okay. Again, individual feedback is provided, and as I said, the access is unlimited for this program. Okay. Now, as I think kind of I'm at the end of this webinar, and I think I have kind of given you the gist of what's happening, what's going to change. As I said, fundamentally, the concepts of nursing or the content knowledge does not change. It remains the same. The pattern is changing a bit. The scoring is changing a bit, more case study questions, and these are the major changes that is going to happen. How you can prepare, as I said, if you need professional help, we are there. If not, then definitely go through all your content resources and your books and everything, start your preparation. And I think by early next year, you'll see a lot of new mock examination formats or companies who are going to come with new mock exam formats as well. Okay. And I think if you are a bit tech savvy, which means that you're okay with the computers, you have a basic understanding of English and basic understanding of instructions, this is not something which is going to be very complex for you. But yes, if you think that these are concepts that are challenging for me, definitely go and take professional help in terms of your preparation very well. There has been something called a special research section, and it's basically that many students who have gone and written the examination, what they have said is that this is just a trial for those who, they're trying to test new questions, and this is a completely optional part of the exam, and it's randomly allocated. So you will, once you complete your actual exam, you will be able to see a special research section which says that you are required to stay for another 30 minutes to try the new exam format, and you can say no if you don't want to, and or you can opt in if you want to. Those questions are not marked in your actual paper, but that basically helps NCSBN to understand how the students are basically reacting to those questions. So it's just like a testing that they are doing. Okay, that will continue until March, till the time the new exam format starts. But yes, if you have time, like we're sitting in October, you have enough time. I would suggest you that, why do you want to waste time? Try and see if it is possible for you to write the exam before March. If not, then, of course, the exam is changing, then you don't have any other option. You have to go for the new examination format. But, you have another 6 months. Don't waste your time, and see if it is possible for you to write the exam in the older format. Any other question? So as I said, you can see on the screen that we have already put our email address, our contact number, and all our other links. You can note down the contact number. It's most of the time I may be able to pick the call up and speak to you. If you have any questions about the OBA, you need help with your NCLEX preparation. Now, see, we are taking, and you can start your NCLEX on any Monday of your choice. So you can start as early as this Monday if you want. And I'm happy to answer any questions that you may have about the procedure, or also in case you are interested in knowing about the alternate pathways except OBA, and if you're open to study other courses, I'm very happy to help you with that as well. Recording of this session, and then if you have any questions, please feel free to ask me or WhatsApp me or message me or email us via the contact details provided. Okay.